Hello, this is Gary Crowley with DoItYourselfJointPainRelief.com, and this is video 2 of 4 videos for lower back and buttock pain relief. In video 1, we released all these big strong muscles on both sides of your hips. We released your tensor fasciolatum muscle on the side of your hip, and we released these muscles, your IT band and your vastus lateralis, your outer quad, these big ones on the sides of your legs. So now we're all set up. Now that these big bullies are all at least on their way to being completely released, now we're going to release the front of your back, where these big muscles basically on the front of your hips and the front of your spine are, and if they're tight, they can be causing you problems. So we're going to be releasing your psoas muscle, which is right there, and your iliacus muscle, which is right there. This is looking at a body from the front with your intestines moved out of the way. So this is the front of your spine. Up here is where your rib cage, your sternum would begin. So way up here your psoas starts. This big rope of a muscle, the filet mignon in a cow, comes down here, down the side of your spine on both sides. And this muscle that wraps the inside of your pelvis called your iliacus muscle, the psoas and the iliacus come together and they hook in to basically the inside kind of top of your leg bone, right there. So, so basically, when those are free, if they're tight, they can make your structure basically have to compensate from this inappropriate tension, and they can make your low back and buttocks hurt. So we want them released. So what we're going to do to release them is we're going to lie on our back, and the first thing you want to do is right around where your pant line is, your belt line is, underneath that you'll find those two pointy parts of your pelvic bone called your basically your anterior superior iliac spine, if you're interested. But basically just those two bones, kind of the highest point on those pelvic bones when you lay on your back. And if we're going to work on, say, this side, the left side, you're going to take your right hand and you're going to find that anterior superior iliac spine, and you're just going to come in toward your belly button about an inch, and then you're going to push into that soft tissue down and in at about a 45-degree angle, so that you're pushing back into that muscle I showed you called your iliacus. And you're just going to start kind of up at the top there and press into that like you're pressing back into that hip bone, and you're going to work your way down to all the way down to kind of your pubic bone. And you're going to notice where you're tight, and you're probably pretty tight there. I'm a little tight up top here, not too bad usually, but I'm just going to do that press pull release technique, and what you'll notice is I'm taking my other hand and I'm using the strength of this arm to press in a little bit. It's kind of hard to do just with one hand, doing the work and providing the pressure. So you can either grab your hand or you can grab your wrist, depending on what you want. Everybody's a little different. So now so this hand's doing the pushing, and this hand's almost doing the little fine tuning. So I just press in and release and press and release. You want to be gentle. You got some intestines in there and things that kind of got to squish out of the way, but they're kind of like, wet soap. They kind of squish around if you're just gentle. And you press in, press, pull, release, press, pull, release, press, pull, release, and you'll find you can also do if you find a tender spot that's a little stubborn, you can press on it and do a press hold move. And again, all these techniques are on my techniques page, where I got about a minute long video to show you how to do these. But a press hold move, you press, stay on that tender spot, and then if you just tuck your tailbone, you'll feel that muscle move under your pressure, and it also helps your brain know that you want that released. So you can do a little of both, and then you come over and do the other side. You take the opposite hand, you find that pointy part on your hip bone, come in toward your belly button, press down and in about 45 degrees, and just notice where you're tight. See, now this one I'm tight a little lower. I'm not tight up top, I'm tight a little lower right there. So I can do a press hold move, I can do a press pull release. My brain seems to like a little press pull release better, so I do a press pull release, and there it goes. And again, I'm not really tight here. You might need to take your time and do a little of both, mix it up, and you'll find, but they will let go if you're gentle and patient. So that's your iliac muscle, iliacus muscle. Now we want to release your psoas that runs along your spine. So now again, if you're going to work on, well, if you're going to work on, say, your right side, this time you're going to use your right hand. You're not going to use your opposite hand. And you're going to find your belly button and come out about an inch. And then you're going to find and go down all the way to your pubic bone and then come up about an inch. So you're out an inch from your belly button and up an inch from your pubic bone, and then just press, again, kind of straight down, really. You're really kind of going down like this, but again, I'm using this other hand to create some pressure. So this hand gets to be nice and gentle because this hand's doing the heavy lifting of applying the pressure. So I'm just pressing down, and well, there's a little tender spot. And again, you want to go slow, be careful. But this psoas muscle is just like any other muscle. If you press, pull, release on it gently, and you can do a press, hold, move again just by tucking that tailbone, it will let go. You just want to take your time. You just take your time in there, and there, mind, let's go. And again, I'm not exceptionally tight here. I work on some clients, it can feel even a little gravelly in here. But you just take your time. Your body, everybody's a little different. Everybody's, got to take their time and have it done in the way their body wants. So don't rush. And again, just go slowly. All your intestines and stuff, you're still going to be pressing through a layer of intestine, even at the very end. But most of it will kind of squish out of the way. And you just press, pull, release, and you want to relax your abs. And you do that. So now, you do this on the other side. Again, when you're psoas, we're going to do the same hand, same side, out an inch from your belly button, down to your pubic bone, and then up an inch from your pubic bone. And then you just press in there. And you notice, this left side of mine isn't tight at all. And a lot of times you'll find in your own body that one side is tight and the other side isn't tight at all, or both are pretty tight. It depends how you've used your body and how it's adapted to the life you're living. So again, you're coming in here, and when you're working on this muscle that wraps the inside of your pelvis, you're kind of using your opposite hand, the hand from the other side. The fingertips are going in here, and in this case, it'd be, if this is your right side, your right hand would be grabbing the left hand that's pressing in here. When you're working on this big psoas muscle, I use the hand from the same side. So if this is the right side, I'm using my right hand to fingertips in here, and my left hand is kind of doing the pressing on my right hand to help that work. So free those muscles up as best you can. If there's if there's stuff that's really stubborn, after a little while, feel free to let it go, and we'll go do some other stuff. Sometimes doing the other stuff helps it release, and then you come back and it's already released, or you do a little bit of work and it lets go. So that's your releasing the front of your back. I want you to assess how your lower back and buttock pain are after doing step 2. And again, remember, if there's one particular thing you might want to come back to later on and just check into because it was a little stubborn. That's step 2. I look forward to seeing you at step 3, where we're really going to get into these hamstrings of yours. And I thank you for your time. Thanks.